Hello again, everyone. This session is to continue our concept integration of nursing as a science. And we will cover all the remaining steps of the nursing process. And to start, we will cover the diagnosis. The first step of the diagnosis is to review the data collected and then later on categorized according to relevance and later on be compared with the normal patterns of growth and functioning. Um, so data are categorized and organized through clustering. Some institutions adopt certain models in their standards so that data can be properly organized. Like for example, in FEU Institute of Nursing, we are using Margaret Gordon's patterns of functioning as we have mentioned in the previous session. So we use this model to give structure to the data gathered regarding the patient's current condition and status. So the nursing process portfolio for the case uh, that you are going to submit during the case presentation will use the Gordon's 11 patterns of functioning as categories. Data is necessary in identifying nursing problems by paying attention to the relevant data that can signify signs and symptoms of a particular problem. And these relevant data could be data that reflects a change in the usual or normal pattern of the client or an unusual pattern for the general population, or there is a difference in the growth and development pattern from the norm. So upon comparing and examining or studying the elements, the nurse makes an inference of a possible nursing diagnosis based on the signs and symptoms. So again, the data are grouped, categorized, and analyzed and interpreted according to its relevance to a particular nursing problem, which brings us to the second step of the diagnosis, which is to identify actual and potential problems. Okay, so from the group data, we need to identify if the cues represent an actual or potential nursing problem. So actual problems are those that reflect signs and symptoms of health problems, while potential problems are those that reflects health history, lifestyle, and environmental factors, or any other data, as long as they are not a sign nor a symptom. Data about the strength, weaknesses, and resources are also necessary to plan for appropriate interventions and for a holistic plan of care. Okay. The third step is to state the nursing diagnosis. As you have learned, nursing diagnosis is different from the medical diagnosis. The nursing diagnosis either reflects the physiological, psychological, cognitive, emotional, and social responses of the client to a particular illness. So for example, deficient knowledge related to lack of recall on wound care as it relates to the cause of the problem. While the medical and surgical diagnosis is the etiology and the pathophysiology of the disease itself, or the abnormality in structure and functions of a certain organ or body part. Like for example, instead of saying wound, it is diagnosed as superficial incisional surgical site infection of the right limb, as a medical diagnosis. Okay? By stating the nursing diagnosis, all assessment data is synthesized to better understand the condition of the client and determine which action should be or should not be implemented by the nurse. Also, there is a certain way of stating the nursing diagnosis. It could either be a two-part statement, which includes the problem and the etiology of the client's problem, or a three-part statement, which includes the problem, etiology, and the signs and symptoms. Now, for actual problems, we use the PES format, or the three-part statement. While for risk diagnosis, we use the two-part statement. No, we don't need to include the signs and symptoms because the problem is not yet existing. But the risk for developing that same problem is already existing, and thus etiology can be identified. All right? The fourth step of the nursing diagnosis is to analyze diagnostic decisions to prevent error, to make sure that the nursing diagnosis truly encompasses the client needs. The data should be verified with the client and the healthcare team, as we had mentioned in the previous discussion. Also, analysis of the client's response to illness should be made using reliable sources. In doing analysis, it is helpful to make both scientific and situational analysis. When we say scientific analysis, it reflects reference-based causes and consequences of anatomical and physiological changes. No, while situational analysis is the client's circumstances, no, that predispose the client to develop the disease. So it refers to the incidents leading to the occurrence of the client's health problems noted as they appear and identified from the client's health history. Okay? In the nursing portfolio submitted by the students, no, about a particular case or client, no, the scientific analysis is facilitated when the student nurse is doing the pathophysiology, where the student first discusses the overview of the disease that would include the definition, and of course it will be written with citation. And then next is the discussion of the anatomy and physiology, no, that focuses only on the body part or the body system that is affected, also with citation. And then the third part of the pathophysiology is the contextual mapping, which is best represented, no, in doing the natural history of disease. No, so as you can see in your screen, no, the diagram for the natural history of disease is is shared with you. So note that with the table on the on the on the first column is the pre-pathogenesis phase, wherein etiologic factors are present, and these etiologic factors, no, are addressed through the primary level of prevention as intervention. And then next, the second column is, until the third column, is the pathogenesis phase, wherein the disease is progressing, no, or the illness is progressing. And the acute phase, no, of the pathogenesis phase is is addressed through the secondary level of prevention as intervention, no, or the acute care. And then uh, the progression of the disease until whether the client is rehabilitated, no, or the client dies, no, is yon. On that part, it is addressed by the tertiary level of prevention as intervention. Okay, so again, um, this pathophysiology, no, helps the student nurse understand, no, the disease occurrence, and also how it progresses, how it affects the client, and thus help the students also identify or study the corresponding levels of intervention that the client needs. So when the student understands this, it helps him or her, now to plan also carefully when she is doing the nursing process. Okay. The situational analysis that we have mentioned, no, in the previous slide is facilitated, no, in the nursing portfolio through doing the ecologic model, no, paper. So being flashed on your screen right now is the ecologic model uh, paper of our developing case at EdPuzzle. So we start identifying the hypothesis, uh, which is an educated guess about the cause, no, of the client's condition, followed by the predisposing factors, no, which list down all the possible causes, no, of the problem, the health problem, and then followed by which ecologic model best illustrates the interaction of the host, the agent, and the environmental factors. And in this case, we have identified the web model. Okay, I will not anymore discuss to you the details because it will be uh, discussed also in the nursing portfolio discussion of Sir Bailon. All right. The fourth part of the ecologic model is the analysis, no, with citation, wherein we try to understand, study if the factors that we have listed, no, in the second part of the ecologic model paper, uh, or in the ecologic study is according to or based on scientific literatures. So we come up with analysis with citation. Okay, and then the last part of the ecologic study is the conclusion. No, if the hypothesis is correct or not. No, so and along with the conclusion are the recommendations. So if the the student nurse is able to do the ecologic study, then she would be able to understand the different circumstances or the factors, no, that has predisposed the client to develop a particular health problem. Thus, she will be able to plan carefully for possible interventions. All right. So again, this helps the student nurse do the situational analysis. The next step of the nursing process, which you have learned so far, is the planning. And again, within the step of planning are sub-steps, which wherein we first list all the actual, potential, and risk problems. After listing, we prioritize them. And after prioritizing, we then establish goals, either long-term or short-term, and then later on set specific objectives, no, SMART objectives, specific, measurable, attainable, realistic, and time-bounded objectives that are that aims to achieve, no, the goal that we have established. And then so the objective should be stated in relation to the goal. So, and then the last step is to write and communicate the nursing care plan. All right. After identifying, no, if the nursing problem is an actual or a potential risk problem or a possible nursing problem, we then prioritize the problems as we have mentioned. And among all the list of actual and potential problems, we categorize them as either high, intermediate, or low priority. Life-threatening problems should be the highest priority, followed by the health-threatening conditions as intermediate priority, while problems with developmental needs and those that do not need much nursing assistance are low priority. Okay? Step 3 of planning is where we establish long-term or short-term goals. So what is the difference between the two? Short-term goals are those that are said to meet immediate and physiologic needs. Like the goals we establish in acute care settings, such as in emergency room, ICU, clinics, dialysis centers, where which require short-term goals. While long-term goals, on the other hand, are established when caring for patients in the long-term care settings, such as home care, chronic care hospitals, rehabilitation centers, hospice care, respite care, and community settings. Now, the next step is to set objectives in relation to the goal. In stating objectives, they have to be SMART. No? So we already discussed what SMART stands for. So again, a SMART objective is a specific, measurable, attainable, realistic, and time-bounded objective. Okay. Also, there are a lot of measurable verbs that we can use when we are formulating objectives of cognitive domain, psychomotor domain, and affective domain. So it's good to be able to choose very well the measurable verbs that we are going to use in setting our objectives. Also, we must take into consideration the logical sequence of the objectives that we are establishing. So it's worth to remember to identify first what is the first concern or issue that we need to address. No? So it doesn't always follow that we will start first with cognitive abilities or cognitive domain. So it would still depend on the need of the client and the urgency of uh, urgency of the needs of the client. So logical sequence of the objectives is very important because it will also direct the interventions that we are going to plan to resolve the problems of the client. So in the nursing portfolio that student nurses are submitting, we include the problem identification and prioritization to help us in the planning stage. So we rank the nursing diagnosis according to the prioritization guidelines that we have discussed a while ago. So I have captured here shown in the slide the ranking of the identified nursing diagnosis of our client in EdPASL. Okay, but I did not anymore capture the other problems. So I would just like to show you a picture. Okay. After the prioritization, the next part of the nursing portfolio is the nursing care plan. So this is the nursing care plan of the top priority problem of our client at EdPuzzle. Okay, so again, I just captured the first stage, but you will be able to see the the whole copy of the nursing care plan in the nursing portfolio. Okay, so notice the alignment. So on the first column, the cues, the second column, the nursing diagnosis, with the diagnostic label, the etiology, and then the defining characteristics, the signs and symptoms, then the scientific and situational analysis, followed by the goals and objectives. So I mentioned a while ago alignment. Notice that the intervention and the rationale, as well as the evaluation, are aligned together. So like in this case, the first specific objective, it has, in this first page, I have already captured 3 interventions, but actually there are other interventions written in the nursing care plan to achieve this first objective. Okay, and then the rationale why we are giving these interventions, why we are rendering these interventions. And then the evaluation, if the goals and the objectives are met, no, and or are they partially met or unmet? And if they are unmet or partially um, met only, then we cite the reasons. So we again examine the factors that interfered, with the goal attainment. So we might consider doing the process evaluation to examine the effectiveness, efficiency, appropriateness, adequacy, and acceptability. Okay. We also have the discharge plan in the nursing portfolio. Also, we need to prepare the client for discharge. And so in planning, we also include discharge planning. So this is the discharge plan of our client at EdPASL. Okay. And shown in the screen is the continuation of the discharge plan from our sample nursing portfolio. Then the next step of the nursing process that you have learned so far is the step of implementation, where we carry out the plan that we have created to resolve the client's problems, nursing problems. And we have discussed that in the implementation, there are actually sub-steps. So in general, we have the pre-implementation or before actual implementation. The second is during implementation, and after is the post-implementation. So during the pre-implementation, we prepare the nurse. So we prepare self. Now we prepare the nurse, we prepare the client, we prepare the other healthcare team members, and also we prepare the materials, equipment, supplies. And after the preparation, next would be the actual implementation of nursing interventions. Okay, with adequate interpersonal, cognitive, and technical skills. And then the last step is to document. Or during post implementation, we document and we communicate the care rendered. All right. So how does a nurse prepare for implementation? First, she has to determine if she needs help, from the other members of the healthcare team. And also she needs to be able to understand very well the how to do the procedure, the intervention, what is the reason, what is the rationale for doing the intervention, where will it take place, and how is it going to be implemented. Okay. If there's a need to delegate, so the nurse also must be able to do that so that she can also prepare the other healthcare team members. No, okay. Or if there's a need to delegate to nursing assistants, so that the nurse would also assess the possibility of supervision, of the delegated care. So yun. And then how do we prepare the client? So of course we need to inform the client about the procedure, what we need to inform him what the procedure is all about, why is it given, what are we expecting from him, does he need to cooperate, how should he cooperate, and also what are the expected response from the interventions. Okay, and yeah, so and others, and we said that we need to also prepare the materials to save time and effort and to ensure the efficiency. Okay, And we will be able to do all of this if we have, or we can demonstrate the interpersonal skills, the cognitive skills, the technical skills, and then later on the efficient documentation. So if we have all of these, then we can say that our implementation will be effective. All right. Also, you have learned that in the implementation phase, all nursing interventions should be based on practice standards, no, which means that these practice standards are based also on scientific principles and scientific studies. No, so they were proven to be effective in a particular population group. Also, we having the disease or the health problem. Now, the healthcare delivery system is very dynamic because of also of the changing, and the challenging needs of our client. So, nag-evolve. Kaya the interventions also must keep pace, must be able to keep pace with all these changes and challenges, in the healthcare needs of our client in a very dynamic healthcare delivery system. So that's why uh, nursing nursing should be evidence-based. Now, in evidence-based nursing, we are able to upgrade, our interventions, or we are able to keep pace with the new trends, new trends in nursing interventions. And actually, to do that, we involve ourselves with evidence-based nursing projects. Now, in the nursing portfolio, the student nurses are also being trained, to develop skills on evidence-based nursing, and this is achieved through asking the students to write the evidence-based nursing paper or the EBN paper. So flashed on the screen right now is the EBN paper the uh, that we have for our client in the Ed Puzzle activity. So the parts of the EBN paper includes first the clinical question that starts from a general question, then later on we reconstruct the general question to have a more deliberate and more straightforward um, inquiry, about this particular intervention. And then we put it in the table to scrutinize the elements of the reconstructed question through using the format COPES, or the client-oriented practical evidence uh, search format. So in the first column, the client type and the problem, and then the second column is what you should do, what might you do, which is the statement of possible intervention. The third column is about the alternative course of action. No? And the fourth column is what do you want to accomplish? Okay. There is also another format, in the next slide. So aside from COPES, we can also use the PICO format, which stands for the patient. P is for patient or problem. I is for intervention. C is for the comparison. And O is for the outcome. Okay. Then after that, we have, after examining the elements of the question, we then proceed to the critical review, with summary of the literature. So we try to search literature that would possibly answer this question that we came up with. And so upon searching, we found a study that will be able to address that question. Then we cite, we put the citation, the title of the journal article, uh, and also the next part of the EBN paper is to discuss the study characteristics from that study that we have, that we were able to gather. After the study characteristics, we proceed with the discussion of the methodology, which also include the approach, that was for the method, the research method that was utilized in the study that we searched, the outcome measures, if identified. After the methodology, we proceed with the results of the study, followed by the author's conclusions and recommendations. So again, the author who conducted the study, which we cited. Okay. After the author's conclusion and recommendation, the student nurse then discusses the applicability of that research material, of that evidence. So after the applicability, uh, next is the reviewer's conclusion or commentary. So it is where the student nurse can write, uh, his review, his own conclusion, his comments about the study that she is critiquing. And after that, the next step is to evaluate, the nursing care practice. Specifically in this PBN paper, the interventions can be evaluated. So please note, that there were two comparative, that there were two type of interventions that are being compared. So the evaluation is according to safety, competence of the care provider, appropriateness, effectiveness, acceptability, then efficiency. So those are the criteria. And then the last part, or the next part, is the recommendation. The recommendation of the student, who is writing the portfolio, or the group of students. And then the last part is the list of references. Okay, so this is the sample EBN paper in our nursing portfolio for our client at Edpuzzle. The last step of the nursing process that you have studied so far is the evaluation, where we try to determine if the desired outcomes were achieved. And also, it is where we identify, the factors that has contributed to goal attainment. And it is also when it is decided if the patient should be discharged, from acute care settings or from healthcare. And more specifically, to do this, to do those, we need first to collect again data. So we need to reassess. After reassessing, we compare the data that we have gathered currently to the data that we have gathered before. Okay? And after comparing, then we identify, the structure, the process, and the outcome evaluation. And then step 4, we decide whether to continue, modify, or terminate the intervention. Okay? The evaluation of patient care intervention basically aims to assess the client's response, to evaluate the client's response to the care interventions, and also for quality assurance and quality improvement. And each one, is done through a specific type of evaluation. For client's response, we do outcome evaluation, where we try to determine if the desired outcomes are achieved through observing the etiologic change, or if there is any improvement in the cognitive, psychomotor, or affective domains. Okay. For process evaluation, to ensure quality, we we try to examine the criteria of effectiveness, efficiency, appropriateness, adequacy, and acceptability. And please take note that evaluation can be ongoing. So we can examine, we examine the process, we examine assessment, we examine the diagnosis step, we examine also the planning, we can also examine the implementation of intervention, and so how, if we have been effective in the assessment, if we have been effective in the diagnosis, if we have been effective in planning, as well as in rendering the planned interventions. So that is process evaluation. And so in process evaluation, we try to identify, what factors, what are the reasons why a particular outcome was met, or was unmet, or was partially met. Okay. Another type of evaluation that ensures quality improvement, is structure evaluation, where physical facilities, equipment, organizational standards, the quality of service provision, the healthcare team's competence, and the adequacy of healthcare staff are being evaluated. Okay, so these are your types of evaluation. By the way, in outcome evaluation, we also have two types: the summative evaluation and the formative evaluation. So in summative evaluation, it focuses on the attainment of the goal. While in formative evaluation, it focuses on the attainment of in examining if the objectives were met. Okay, so before we can have the summative evaluation, we first, of course, examine our formative evaluation, because the attainment of specific objectives should lead to the attainment of the goal. Okay? So to apply the principles that we have discussed in the actual nursing care plan, being flashed now on your screen is a format of our nursing care plan here at FEU. So I have shown this to you a while ago, already, the nursing care plan of our client at Ed Puzzle. But this time, this table should give you, the should guide you, in writing your nursing care plan. So basically, it summarizes, the guidelines that we have discussed. Okay. So you may take a picture of this, or you may have a copy of this. Okay. You may also come up, with your own form, blank form, of the nursing care plan, so that you can fill out, the needed information, na lang, in the table. So you can have something like this. All right. So that would be all for our concept integration recorded lecture for nursing as a science, steps within the steps. This is again Miss Geraldine Cañete, And thank you for joining me in this learning adventure.